It's a shocking statistic. Did you know that more than 36,000 Americans will die from the flu this year? Flu season is on the way, and now is the best time to protect yourself. Bradenton Cardiology Center and Daytime's resident Dr. Srinivas Iyengar is here to tell us what actions we can take now to stay healthy and what to do and not do if you get the flu. Good to have you here.
Well, great to be back.
So 36,000 people die, honestly, from the flu?
This is a very startling statistic, very important statistic, because the flu historically has caused pandemics. Pandemics mean wide-ranging diseases in the human population, wiping out populations at times. It's very important that we emphasize this isn't just a cold. You know, the flu is a virus, and it can be a deadly virus if obviously not treated well.
You recommend should definitely get one.
Children over the age of 2 years old, up to, say, 80, 85, depending on your age, depending on your comorbid issues, should get the flu vaccine.
Did you say 2 to 85?
A wide range.
Okay, so basically everybody.
Everybody, unless you have certain issues like egg allergies, a history of something called Guillain-Barré syndrome, which is something you talk to your physician about.
Right.
But the flu vaccine is very important. It does only cover for 3 major strains of the flu, and it may not be the virus that's out this year. I know there's been a lot of talk about, well, it covers last year's strain, or it's not the strain that the swine flu example. It doesn't cover that. But the fact is, it does cover some. Even if it's only covering 60% of the flu strains or 50%, it's still better than not having anything at all.
So what do you say, or what's this about people who say, I just got the flu shot, now I feel awful?
The thing is, side effects do exist from the flu shot. There is no doubt that you can have a localized allergy, and some people do complain of flu-like symptoms or muscle aches from that. Potentially, though, it could also be that you're picking up another infection that's already in the area, because the flu vaccine does take a couple of weeks to get effective. It's not immediate. So that's another thing we like to tell people who are getting it. Don't think that you get the flu shot today, tomorrow you can basically walk around and think that you will not be
totally immune
to anything else that's in the environment.
What if you do get the flu? Is it easy for a doctor to be able to tell that you actually have it?
It's not as cut and dry as everybody likes to assume, but if you have the symptoms myalgias like muscle pains, high fevers, chills with the myalgias itself, around the season of flu, chances are it may be it, and you need to be away from other people at that point in time. Now, if you get it within the first 24, 48 hours, there are remedies for the active flu infection. Something like the sort of like Relenza, Tamiflu. These are medications that are available from your doctor that you can get. I also do see a number of patients take herbal remedies. Herbal remedies are very popular. People want to treat themselves. They're like, why do I need to go to see a specialist when I can just treat my own body?
Right.
I'm not against herbal remedies, but I'm not telling them to do that in lieu of the vaccine. Okay,
well, we actually had the herbal pharmacist in not too long ago, and he said, do not get the flu shot. And I'm going to have you listen to what he says, and then we're going to have you answer to that.
Here's the reality. There are hundreds of strains of flu virus in our environment. The flu shot covers 3. So to me, and the flu shot this year was decided on last year, so it was sort of a crapshoot as to what the 3 most popular viruses that we might come in contact with will be. They made flu vaccine for that for this year. So you're covered against 3 if you get the flu shot. Well, maybe. Here's the thing. It takes about 6 weeks for the flu shot to work.
What?
Yeah, it can take up to 6 weeks for it to work. So if, let's say you got your flu shot today, and in a week you actually came down with the flu. It wasn't from your flu shot. It's because you were already exposed to the virus and it took over. So you know, 2 things. Basically, you may not be covered because you've already been exposed, and 2, what's in the vaccine may not be what you get exposed to. So I'm one of these people that recommends, you know, let's just take our body under control, take some supplements, get some rest, eat right, that kind of stuff.
Well, you're here now, so let's hear your rebuttal to that.
Well, I actually agree with some of the points. I do believe that, first of all, he's right. The flu vaccine doesn't cover against majority of the strains that are available. And the fact is, it does take a couple of weeks, like we just mentioned, to take effect.
That's why you have to get it early.
But exactly, in the season, getting it earlier the better. But there are still over 30,000 Americans dying from this a year. And if you have those other issues that we mentioned, if you're pregnant, if you have COPD, diabetes, over the age of 65, letting yourself rest and taking supplements, in my knowledge, in my academic background, is not enough. I really firmly believe the flu vaccine saves lives. I have no problems taking echinacea, ginseng, vitamin C, in addition. But I will not replace the vaccine based on this, just for the fact that even if you're not covered against the strain that's out, the fact that you have some coverage and you have some type of disease, like I said, even if it's just your age, I still suggest it highly that everyone talk to their physician about this. And obviously, if you want to make that decision, it's your your body. But in my expert opinion, I do believe in the flu vaccine.
Now, what is this about not taking aspirin if you have the flu?
Well, aspirin can, in children especially, in adolescents, there's this condition called Reye syndrome, R-E-Y-E syndrome, which can cause the brain to actually have some inflammation with, when you have an active flu infection, the virus, aspirin can actually exacerbate that condition. So in people, if you have any suggestions of these flu-like symptoms, the myalgias, the high fevers, that are not particularly arranged with a cold, definitely talk to your physician first.
Okay.
Don't take an over-the-counter thinking that you're treating something else, because it could potentially get worse.
Okay, Dr. Iyengar, thank you very much. And if you would like to learn more about the flu, you have to like Dr. Iyengar on Facebook by going to our website, daytimeonline.tv, and clicking on his picture. It will take you right to him and his Facebook page.
Exactly.
Thank you very much. We'll be right back.